What happens when you stop smoking? 20 minutes. After 20 minutes, your blood pressure and pulse will start to return to more normal levels. Fibers in the bronchial tubes that help move irritants and bacteria out of the lungs start to move again. This helps to reduce the risk of infections. 8 hours. Within 8 hours, your carbon monoxide levels will start to return to a normal level. Your oxygen levels start to increase to more normal levels. This increased oxygen helps nourish tissues and blood vessels that were getting less oxygen while you were smoking. 24 hours. After 24 hours, you've decreased risk of a heart attack. This is because of reduced constriction of veins and arteries as well as increased oxygen levels. Nicotine levels in your bloodstream have also decreased to negligible amounts. 48 hours. After 48 hours, previously damaged nerve endings start to regrow. You may also start to notice that senses that were previously dulled due to smoking improve. You may realize you're smelling and tasting things better than you were before. 72 hours. Within 3 days, you'll find yourself breathing more easily. This is because the bronchial tubes inside the lungs have started to relax and open up more. This makes air exchange between carbon dioxide and oxygen easier. Your lung capacity also increases around 3 days after quitting. 1 week. The 1 week milestone. Smokers who make it 1 week without smoking are 9 times more likely to successfully quit. The chances of quitting for good increase with every attempt. 1 month. In just 1 month, you will experience many health changes. One is feeling a sense of heightened overall energy. You may also notice that many smoking-related symptoms have decreased, such as sinus congestion and shortness of breath with exercise. Fibers in the lungs that keep them healthy are growing back, reducing excess mucus buildup and protecting against bacterial infections. 6 months. After 6 months, many people often notice that they're better able to handle stressful events that come their way without feeling the need to smoke. They may also notice they're coughing up much less mucus and phlegm. This is because the airways are less inflamed without the constant exposure to smoke and the chemicals contained within cigarettes. 9 months. After 9 months, the lungs have significantly healed. The delicate, hair-like structures inside the lungs known as cilia have recovered from the toll cigarette smoke took on them. These structures help push mucus out of the lungs and help fight infections. Around this time, many former smokers notice a decrease in the frequency of lung infections because the healed cilia can do their job more easily. 1 year. After 1 year, a person's risk for coronary heart disease decreases by half. This risk will continue to drop past the 1 year mark. 5 years. After 5 years without smoking, the body has healed itself enough for the arteries and blood vessels to widen again. This means the blood is less likely to clot, lowering the risk of stroke. The risk of stroke will continue to reduce over the next 10 years as the body heals more. 10 years. After 10 years, a person's chances of developing lung cancer and dying from it are roughly cut in half compared with someone who continues to smoke. The likelihood of developing mouth, throat, or pancreatic cancer has significantly reduced. 15 years. After 15 years, the likelihood of developing coronary heart disease is the equivalent of a non-smoker. Similarly, the risk of developing pancreatic cancer has reduced to the same level as a non-smoker. 20 years. After 20 years, the risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their life. Also, the risk of developing pancreatic cancer has reduced to that of someone who has never smoked. Smoking is a harmful habit that can lead to severe health complications and death. When you quit smoking, the body will start to naturally heal. Some effects, such as lowered blood pressure, are seen almost immediately. Other effects, such as risks of lung cancer, heart disease, and lung disease, take years to drop to the levels of a non-smoker. However, each year of not smoking decreases risks and improves overall health, making quitting an excellent choice for anyone who started the habit.